Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to health care. May is Mental Health Awareness Month, and according to the Missouri Department of Mental Health, more than 1.2 million Missouri adults have some degree of mental illness. Dr. Zane He is a psychiatrist at the University of Missouri Student Health Center and spoke about how he's seen the stigma around mental health change during his career and about how people can look out for one another. Here's Dr. He.
All in all, I'm very happy with the direction things are going in terms of mental health. I've been counting medical school. I've been in Columbia for about 10 years now. And I think over the years, there really has been a greater focus and greater acceptance of mental health. So right now, my current job, I'm not seeing a whole lot of patients that are more in the elderly population, but when I was a resident, when I was training, I would have a lot of elderly patients tell me that, hey, they've been always ashamed or embarrassed or feel like it's inappropriate to talk to people about mental health. And a general trend I've been seeing is that that stigma has gotten much less recently, especially amongst the younger population. Yeah, people tend to be a lot more open to disclosing their own mental health struggles and also asking their peers, asking their friends how they're doing mentally. And so I really like this trend that we're seeing. When we talk about suicidality, that's typically only when depression gets to a boiling point. A lot of times people struggling with depression don't have it so bad that they're having suicidal thoughts. So what are some other signs, maybe more subtle signs of either depression, anxiety, or some other mental health issue? I would say maybe a decrease in functionality or activity would be a very good thing to watch out for. So if, let's say you have a friend that you see on the regular, you, I don't know, hang out once every weekend or so, and then for the last 3 weekends, they've been giving you reasons, for whatever reason, they're just not spending much time with you. That might be a good time to just check in, be like, hey, are you doing okay? Is there anything I can do to help you? Something like that. Aside from that, I would say conditions like depression and anxiety can affect various other aspects of our lives, like it can make it so that it's difficult to fall asleep, or it might make it hard for us to eat well or to focus well. And if you find yourself struggling with those areas, that could be a reason for you to talk to a professional. I strongly encourage people to talk more about mental health. I think the more that it gets spoken about, the less stigma there's going to be regarding that.
That was Dr. Zane He with the University of Missouri Student Health Center speaking about how simply talking about issues can help reduce the stigma around mental health. If you or anyone you know needs help, call or text the Suicide and Crisis Lifeline at 988. That's it for this week's Missouri Health Talks. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.